I now recognize Mr. Garcia from California for 5 minutes.
Thank you very much, Mr. Chairman. Dr. Welensky, thank you for being here today. I greatly admire and just appreciate the work of the CDC and just the talented personnel and civil servants, and particularly in what was and has been the single largest health crisis that we have had here in the modern era, costing 1.3 million plus American lives, 1,300 lives within my own city of Long Beach, where I was the mayor during this entire time. And so I know the hard work that you and your team have gone through. And I also want to note that it's just been interesting to hear this hearing and seeing so many of our House Republican colleagues in the majority all of a sudden just have such interest in exactly what happened and medical expertise, considering that they are and have been completely whitewashing the Trump administration's role early on in the pandemic and their political interference, clear political interference in actually what happened, and trying to consistently insert themselves into the CDC response and the CDC communication to the American public. We want to remind us that President Trump repeatedly tried to undermine the CDC's work and advance his own re-election campaign. We've heard a lot about President Biden the current president's name being brought up, but it was President Trump, as we should remind ourselves, that actually led the initial response and time again tried to interfere with the CDC's work that at the time was very, very difficult and continues to be. I also want to note there's nothing that suggests that teachers somehow played some outsized role in CDC policymaking, and there's certainly nothing to suggest that they somehow got health experts to make dangerous concessions or changes. There is no evidence of that. It is a political talking point by the House majority. They love to continue and go on and on about it, but there's no evidence of that. We also know that House Republicans actually sat back and did nothing when President Trump and his allies interfered in their work to cover up his own incompetence. Now, Americans died because of the political action, in my opinion, of the former president, and some people here cheered on the president's former dereliction of duty and interference in these actions. I want to be clear and remind us of a few things. Last year's Select Subcommittee report found that the Trump administration conducted a systemic campaign to compromise the integrity of the CDC's pandemic response in advance of the 2020 election and to help former President Trump. On February 26, 2020, he and his allies mandated that all media requests about COVID be first approved by the White House. CDC officials have testified that because of this, there were extended periods of time that his administration completely refused to approve critical COVID briefings to the American people. That's shameful and should never have happened. And throughout that year, as tens of thousands of people were dying, his staff pressured health experts to soften language that might make the president look bad. His allies attacked CDC scientists for publicly sharing information that they believe contradicted the president's message. I want to give an example in an email from May 8, 2020 that shows that Trump allies installed at the Department of Health and Human Services seeking to edit talking points on a CDC report and saying, and I quote, "Any way to help you showcase your work for this great president," end quote. That would, of course, be appreciated. A few weeks later, they even went as far to suggest the CDC edit a statement on COVID deaths to make it, quote, more positive. So the Trump administration pushed staff at the FDA to authorize ineffective treatments like hydroxychloroquine, and we know some of the damage that caused as well. And the president even would tag health officials on Twitter and accuse them of deliberately slowing their work on vaccines until after his re-election. All shameful, of course, not of no interest to the Republican majority here in this committee. Dr. Welensky, can you clarify for us clearly, did the American Federation of Teachers once and for all water down or direct CDC policy on school reopenings?
The American Federation of Teachers was one group out of 50 that we engaged with that were essential implementing partners if we wanted to get schools open. The whole goal was to get schools open. We talked to teachers, we talked to superintendents, we talked to school nurses, we talked to parents, we talked to the immunocompromised community to get our schools open.
Thank you, and I think that's what we have heard over and over again and from everyone involved, and I want to thank you for that again. Now, I think we can all agree, especially given what we learned from hearings in the last Congress, that it's critically important to have a CDC pandemic response guided by medical practices. In fact, when asked in an interview last Congress whether allowing CDC to convey accurate scientific information to the public would have resulted in fewer Americans dying, the agency's former principal deputy director responded, "Yes, I do," which should be alarming to anyone. And so I think it's of note that we have to remind ourselves that the Trump administration, time and time again, tried to interfere with the CDC's response and all the great work that you would all do. So I just, with that, Mr. Chairman, as I wrap up, it's insulting that House Republicans sit here today trying to score political points around our pandemic response, even as they cheer on the man who is willing to let Americans die to help his reelection. With that, I yield back.